welcome in to be our guest. We have so many questions now about our healthcare system, about being able to see physicians. And so, you know what, we have always said that knowledge is power.
Absolutely.
And we are very blessed to have with us today the Dean of the Medical School, Regional Montgomery Campus, UAB Medical School, here in Montgomery, Alabama, Dr. Wick Many. So we're going to go ahead and get to the bottom of some things and actually inform you, because that's what we love to do. So Dr. Many, I'm going to ask you some interesting questions, and actually you're the one with all the answers, so I'll probably just have enough sense to let you talk. One of the things I did want to ask you that is our entire audience is concerned about, and that is, what exactly is the status of the physician environment here in our community?
Well, in Alabama, we're approaching crisis levels of a shortage of physicians. Alabama ranks 45th in the nation of the number of practicing physicians per 100,000. We also rank 45th in the nation in the number of primary care physicians per 100,000. So primary care is internal medicine, family medicine, general pediatrics. More importantly, 25% of our physician workforce is over the age of 60. So we are going to have a significant fraction of the physician population retiring within the next several years. And it's not just in those areas. We also have many counties in Alabama that do not have obstetric care, so that women who are pregnant have to travel 50 to 60 miles to receive prenatal care. And we know that quality prenatal care is very important in preventing childhood mortality and all types of other complications. And finally, we are ranking the bottom 10 in the nation in access to mental health professionals. So across the board, whether you go to any of the specialties of medicine, Alabama is in a serious crisis situation as far as access to quality care.
Now, nationwide, though, obviously, has there been a decline in the amount of young people going into the medical profession in general?
Surprisingly not. The question comes up all the time because of the concerns about the Affordable Care Act. But the number of applicants to medical schools across the nation have continued to increase. The same thing is true here in Alabama. And the quality of the applicants has not dropped off. So the problem is not the number of physicians, it's just trying to get them to stay here in Alabama.
That's the trick.
Absolutely.
Is to keep them here. And I think there are so many people who don't know, we actually have a regional UAB medical school right here in Montgomery, Alabama. And how did we get this? How did this come to be? This is amazing.
Well, the School of Medicine, the UAB School of Medicine, approximately 3 years ago, embarked on a strategic planning initiative to see how it, as a public institution, could better serve the citizens of Alabama. And one of the recommendations from this plan was to create a new regional medical campus in Montgomery to train medical students here in Montgomery, and hopefully in a long-term investment repopulate this area of the state.
Well, for any community to have a medical school in your community is just, it's not just even in the field of medicine, but it's for our community, what it does for our community. And you are the dean of the medical school. I'm curious, who's your faculty?
Well, our faculty are community physicians who are volunteering their time. So when you go see your physician, that physician may be one of our faculty members, and you may see a very, very, very young physician in training, and that's a medical student. They all look like grandchildren to me. But that person that's following around one of our community physicians is one of our medical students. And we think we have some high quality physicians in this community that not only can teach our students the science of medicine, but also the human skills, the compassion, the empathy that is so crucial and that is so important to our goal of training students to become competent and compassionate physicians.
You know, we talk all the time about there's not just one C involved in here. It's not just competency. it's compassion, because when you're in a hospital or you're going to a doctor,
yes.
that you're at your most vulnerable, and kindness doesn't cost a thing, and you're training these physicians to be caring.
That's
and I'm
absolutely
telling
right.
you, there, as a patient and having had a family go through that, that was just as healing as the medicine
Oh,
sometimes.
absolutely. Dr. Many, how long do these students stay here?
They stay here 2 years. So
2
all
years.
of the medical students spend their first 2 years in Birmingham in what is called the basic sciences. That is very classroom and laboratory intensive. After 2 years, the students will come here to Montgomery for their third and fourth year, where they will spend time in all the various specialties. So they'll spend time in internal medicine and family medicine, obstetrics, pediatrics, surgery, neurology, psychiatry, so that they have very in-depth, intensive clinical training here at Baptist Medical Center South and Baptist Medical Center East.
So you're located right beside Baptist,
That's our administrative offices.
and then all of your students can just.
Yes, you'll be seeing them at Baptist South, Baptist East. We also have our students spend time in Selma,
Great.
so that they
Great.
have an opportunity to see how care is delivered in settings that do not have rapid access to all the specialists. So I think that's important as well.
Well, good. Thank you so much for what you're doing here, because I know you were the spearhead in getting this here.
Well,
Thank you so much. And just remember this, that when you're looking for a medical doctor, make sure you give them a great big thank you, because we need all the help we can get in that arena. And we'll be right back right after this.